Hello all, and welcome back to the series of technical tips. I am Dr. Monica Tyagi, application scientist at Biotechne. And today I'll be talking about the transition support for the iCE3 to Maurice platforms. Protein Simple was the first to commercialize the whole column detection CIF technique in the IF analyzer instrument. The iCE instrument revolutionized the CIF technology, starting with iCE280, then iCE3, followed by the launch of Maurice in 2016, which adds iCIF native fluorescence, providing 4x sensitivity. And our latest edition, Maurice Flex, launched in 2023, provides full Maurice capabilities, both iCIF and CESDS, with addition of fractionation of the iCIF charge variants. As we celebrate 25 years of iCE innovation, our dedication to technology advancement continues. We understand that the iCE3 to Maurice transition is a major commitment for your organization. And that's why we are here to help guide you through the process. Discontinuation of the iCE3 system was announced in December 2021 and became effective June 30th, 2022. We are offering full iCE3 service support and consumables for more than 7 years after we announced the iCE3 system discontinuation in December of 2021. We are providing this extended timeline until June 30th, 2029 because of the considerable number of commercial products with iCE3 assays and the numerous additional BLAs in the development or are currently being reviewed by the regulatory agencies. In addition, our next generation Maurice and Maurice platforms offer the same high quality result as the iCE3 system, plus with more capabilities for your lab. Our goal is to share what we have learned from others, help you navigate the transition process. We would like to align with your timelines and provide a trade-in programs to help with your budget. Understand your plan and how we can help, and identify the iCE3 projects. To accomplish these goals, we are working hard, and I will be discussing in today's videos about the bridging studies for the smooth transitions that have been done. An international team spanning 19 sites across 18 biopharmaceutical and in vitro diagnostic companies in the United States, Europe, and China, along with one regulatory agency, was formed to compare the precision and robustness of iCIF for the charge heterogeneity analysis of the NIST map and recombinant human PD-L1 fusion protein on the iCE3 and the Maurice instrument. This information has been requested to help companies better understand how these instruments compare and how to transition iCIF method from iCE3 to Maurice instrument. The different laboratories perform the iCIF on the NIST map and the recombinant PD-L1 fusion protein with both the iCE3 and the Maurice using the analytical method specifically developed for each of the molecules. After processing the electropherogram, statistical evaluation of the data was performed to determine the consistencies within and between the laboratories and the outlying information. The apparent isoelectric point data was generated based on 2-point calibration for the main isoform of the NIST map, showed higher precision between the laboratories with RSD values of less than 0.3% on both the instrument. The SDs for the NIST map and the recombinant PD-L1 fusion charge variant percent peaks area value for both instruments are less than 1.02% across different laboratories. These results validate the appropriate use of both the iCE3 and Maurice for iCIF in biopharmaceutical in support of the process development and regulatory submission of biotherapeutic molecules. Further, the data comparability between the iCE3 and Maurice illustrate that Maurice platform is a next-generation replacement for iCE3 that provides the comparable data. Here you can see the representative electropherogram for NIST map on your left and the recombinant PD-L1 fusion protein on the right. The consistent electrophoretic profiles were obtained by all the laboratories on both the iCE3 and Maurice. Let's take a look at the interlaboratory comparison summary. The NIST map was selected as a model map for this study because it is a commercially available map with well-controlled characteristic that has been studied extensively previously. To evaluate the focusing of the NIST map on both the iCE3 and Maurice, the apparent PI for the main peak was compared. The apparent PI of a protein is determined by including the markers of known PI values within the sample. Now, both the iCE3 and Maurice automatically calculate the PI value for the peak, assuming a linear pH gradient between the PI marker. Therefore, the apparent PI value of peak is highly dependent on the ability of the instrument to focus the ampholyte and the sample in a reproducible manner. To compare the focusing of Maurice to iCE3, the apparent PI value for the main isoform was calculated for each laboratory. Both systems were able to achieve similar apparent PI across all laboratories with a percent RSD between labs of less than 0.3%. Even though 2 lots of pharmalytes were used for both NIST map and recombinant PDL1 fusion protein. This confirms that both instruments can reproducibly focus the NIST map across sites with multiple analysts and multiple instruments. Both systems measured the PI value for the main isoform as 9.26, confirming that both systems focused the NIST map in a similar manner. Similarly, the data sets were analyzed for the recombinant PDL1 fusion protein, and for more details, please refer to the published article. Further, we did an internal study and published an application note. Now, this application note is intended to help ensure our customers of the data comparability between iCE3 and Maurice and showcase the charge isoform characterization of 3 molecules: erythropoietin, monoclonal antibody 11, and NT-alpha-1 antitrypsin. Each of these molecules were run on both iCE3 and Maurice to compare charge isoform peak quantitation and PI reproducibility using absorbance detection. To test data comparability, 3 different molecules on iCE3 and Maurice in absorbance mode were run. A batch of 6 injections was run on 3 separate days by the same operator for a total of 36 injections for each molecule. Samples were prepared fresh each day, and the data generated were analyzed to determine PI and percent peak composition using ComPerfect software. The analysis method for each molecule was kept consistent across the data generated by both the systems. I'll be talking a little bit more about this application note in my further slides. The iCE3 and Maurice system gave us consistent EPO profile that contained 8 baseline resolved peaks. You can see the electrophoregram on your left. The EPO profile had 4 major peaks and 3 minor peaks, with the highest peak at around 0.06 absorption unit. The profiles were also found to be comparable to the capillary zone electrophoresis data provided by the European Directorate for the Quality of Medicine and Health Care, which you can see on your right. Furthermore, the PI positions on both the systems were all within 0.1 PI units and were consistent with CVs of less than 0.1%. Let's take a look at the data set for monoclonal antibody 11. The data was comparable on both the systems. 6 peaks were detected with the main peak at a PI of 7.2, around 0.15 absorption units. The PI values were highly consistent with no variation regardless of the instrument used for the analysis. CVs for all the systems came in less than or equal to 0.2%. Peak composition percentages were all within 2%, even for the minor peaks, demonstrating the data comparability on both the systems. For NT-alpha-1 antitrypsin, both instruments generated comparable NT-alpha-1 antitrypsin profile that all contained 7 distinguishable peaks and a very minor 8th peak around PI 7.2. The major peak, that was peak 5, was greater than 0.05 absorbance unit on both iCE3 and Maurice. Reported PI values were also the same and with consistent CVs of less than or equal to 0.4%. For more details, please refer to this application note. Here is another recently published article in the Journal of Electrophoresis from Boehringer Ingelheim, where a team designed an instrument comparability study to understand the potential performance differences between the instrument and rationalize risk assessment and decision process. In a good manufacturing practice environment, this study design is the first benchmark in ICIF analytics, comparing the iCE3 and Maurice instrument. The core study confirmed equal or better performance of Maurice in all parameters and serves as a basis for seamless continuation for release measurements on Maurice. For more details, please do refer to this article. Lonza presented the poster in a scientific meeting in 2022 describing the qualification of ICIF method on Maurice system upon transfer from iCE3 instrument. The goal was to evaluate the performance of the Maurice system for charge variant analysis of process development sample, specifically to evaluate their purity and stability. The qualification included assessment of 11 different parameters, including linearity, precision, specificity, equivalency, and robustness, leading to the conclusion that Maurice system is fit for the process. The ICIF method using the Maurice instrument passed all the acceptance criteria set in the development plan. This method was thereby considered fit for purpose and can be used for charge variant analysis for process development sample. Therefore, Maurice will gradually replace iCE3, allowing fast and high-quality analysis and without compromising the timelines. So far, I have highlighted the articles and the application notes published and the bridging studies. Here is the summary of the bridging studies that I just discussed and the meetings they were presented. The study on the NIST-MAB and the recombinant PD-L1 fusion protein was presented in the Festivals of Biologics November of 2021. Then the Lonza poster was presented in the European User Meeting, which was in October of 2022. Additionally, there were other bridging studies that were also conducted and presented in different conferences. There was one which was presented in 2022 where there was a technical talk presented by a multinational CDMO, and they showed the comparison and analysis of 5 different maps and the comparability between the 2 instruments. Then there was another one published in 2023 by a major pharma company, and the bridging study evaluated 13 late-stage and commercial products. This year and last year, we had North American user meetings and scientific conferences where they had elaborate discussions about the transition plan from iCE3 to Maurice and the data comparability. These numerous bridging studies, as well as discussion with many users who have or are making the transition from iCE3 to Maurice system, have helped us to develop some guidelines and recommendations for bridging study model. Here is an example for a timeline for iCE3 users. In 2021, received protein simple notice of iCE3 discontinuation of iCE from June 30th, 2022 with full support until June 30th, 2029. Say 2022, purchase and install Maurice with IQOQ and started GXP onboarding. 2023, completed the GXP testing, performed equivalence testing in Empower software, completed first qualification and validation. Following year, incorporate Maurice into routine workflow, deployed Maurice in GMP lab. 2025, provide overview support to commercial programs. Our Maurice platform, it's the same technology, same results with more benefits. And here I will be highlighting some of the key benefits on transitioning to Maurice platform. On Maurice Flex, you can perform ICIF, ICIF fractionation, and CESTS analysis for your molecule of interest. Whereas with iCE3, ICIF is the only application that can be performed. We emphasize the importance of referring to our iCE3 method development guide, which is shown here on your left, when transitioning your method from iCE3 to Maurice. For example, the use of cathodic blocker arginine with the Maurice improved results, especially in the basic PI range. Utilizing the Maurice PI marker, there's an advantage over iCE3 PI markers that you get the increased window. The setup time for the run is faster and easier on Maurice. It requires no transfer time measurement or laborious cartridge installation and setting up the transfer capillary as it is done in iCE3. iCE3 has a longer focusing time than Maurice and hence faster results with Maurice. An optimized iCE3 method is critical for a successful method transfer to the Maurice system. Method development is easier on Maurice due to real-time monitoring of the separation profile, as this feature is attained only with iCE3 a la carte and not the prints. Maurice has a fluorescence detection channel using the native induced fluorescent in addition to UV absorbance. This added capability enhances the instrument sensitivity. Compass software for Maurice is straightforward, faster data analysis, and user-friendly as a single software for all the applications compared to the iCE3 software. In summary, Maurice provides the same high-quality CIF data with more compact footprint to save bench space, unparalleled ease of use to reduce training time and maintenance, and to enable more time to be spent on designing experiment and interpreting the data. The addition of native fluorescence detection provide enhanced sensitivity and troubleshooting and reduced sample prep requirement. Maurice also has the option of Empower Control to provide improved data integrity, the ability to work remotely and to qualify Maurice using Empower. Scientists can quickly and easily switch between the ICIF and CESTS detection in few minutes without the need for thorough cleaning and eliminating the possibility of carryover. Maurice also provides a faster injection time as well as significant labor saving during setup and cleanup with increased efficiency and throughput and reduced cost. As our next generation CIF system, we continually innovate and improve the Maurice platform. Some of these innovations include the fraction capability of the collect isoform fractions and analyze them on mass spec, and our Turbo CESTS cartridge that reduces time by less than 80% while still generating excellent data. Let's hear from your peer. What are some of the key advantages of Maurice and Maurice Flex instrument compared to the iCE3 system? As stated, it's very intuitive and easy setup, both hardware and software. Extremely user-friendly for running assay and system maintenance. Direct data acquisition bridges the compliance gap of data integrity. Native fluorescence feature increased detection, sensitivity to 3 to 20-fold, making it possible for low abundance sample analysis. No new method development necessary for existing iCE3 users. Simply adopt the iCE3 method onto Maurice when using UV 280 detection. Now, capability of ICIF charge and CESTS analysis with one instrument. What are the additional features of Maurice Flex over Maurice? It does everything Maurice can. In addition, it allows fraction collection of separated charge species for subsequent analysis, including MS characterization for intact protein structural identification, peptide mapping for more detailed study on post-translational modification analysis, and potency assay for degraded charge species of stability samples to gain insights on charge-related CQAs. The key takeaways for our iCE users and the frequently asked questions about the iCE3 to Maurice transitions. When is the availability of iCE consumable past June 30, 2029? All common iCE and Maurice reagents will continue. Maurice cartridge costs, now offering the iCE 400 cartridge, a new higher capacity option with up to 400 injections that gives you 40 batches and the rate of 50% increase. iCE3 instrument service beyond June 30, 2029 will make best efforts to accommodate will depend on the part availability. What instrument can I trade on Maurice or Maurice Flex system? You can trade your iCE3, P800 plugs, GH2, Bioanalyzer, and more. And please do inquire about it. I would like to trade in an iCE3 instrument but need it to maintain testing capacity for up to 10 months while I validate the Maurice system. What can I do? You can keep your iCE3 traded for up to 12 months post-purchase your Maurice system. And please do let us know if you have any questions in this regard. We have more resources to help you transition from your iCE3 to Maurice. Please do reach out to us and make best of these resources provided. Thank you for watching this video. Hope you find this helpful, and do stay tuned for more technical tips videos.